Hi everyone, it's Dr. Shopovick, and I hope you all had a wonderful holiday and a very happy new year. But today we are going to review the differences between a hearing aid and a cochlear implant. Now, majority of you are probably more familiar with a hearing aid just because we talk all about those on our channel. So I'm only going to briefly review that today, and we'll spend majority of time focusing on what an implant is. So I'm just going to briefly go over the hearing aid portion. So most of you have probably seen this type of hearing aid before. It is a receiver in the ear canal, and sound comes in through the back of the hearing aid, goes through those microphones, and then the sound gets transmitted down this wire straight into the ear canal. So what a hearing aid is doing is providing acoustic stimulation to our ear. On the other hand, we have cochlear implants. There's two styles for implants. There are the on-the-ear option, so it looks like a hearing aid, but nothing is going in the ear canal. It just kind of sits on the back. And then you have this second piece, that's a magnet that would go right kind of similar to this space on the back of your head. The other style is the off-the-ear. So nothing would be going behind the ear. This would just stick directly on the back of the head. Now with a cochlear implant, what that is doing is providing electrical stimulation to our ear. So a hearing aid is acoustic and a cochlear implant is electrical. Another main difference between a hearing aid and a cochlear implant is that an implant does require surgery. So it is a surgical procedure that an otolaryngologist would perform. And for the procedure, it is outpatient. And as long as you are healthy to undergo anesthesia, you would be a good surgical candidate. So some people are concerned about age. Oh, am I too old to, get an implant? Really age is nothing but a number. As long as you are healthy and you have cardiac clearance, you would be a good candidate. Another component or another important component of an implant that I want to touch on is the internal component. So unlike a hearing aid, there's just one piece. This is just sitting behind your ear and sending sound into your ear canal. With an implant, you have an internal and an external. So for the internal, this is on the inside, so no one, me, you, no one, the public, no one's gonna see this part. This is all internal. So the surgeon would just create a little incision and slip the magnet underneath. And then at the bottom of this, there's like a little spiral at the end that you see there. So that spiral is going to go into our inner ear organ called the cochlea. It looks like a snail, and it just wraps around the cochlea. And this electrode array is what provides the electrical stimulation. So that is how you were hearing through those little electrode arrays. So with a cochlear implant, we are bypassing the inner ear. We are bypassing the middle ear. We are just providing direct electrical stimulation to our inner ear and auditory nerve. The other option again would be the off the ear. If someone did not want it in the ear, or they might have, some kind of ear abnormality, the off the ear may be a better option for them. Another difference between the two is candidacy criteria. So for a hearing aid, a person needs to have a mild to profound hearing loss, and their word understanding is usually 50% or greater. For a cochlear implant, it's for someone that has more of a severe loss. So that person needs to have a moderate to profound sensory neural hearing loss. and their word understanding needs to be 50% or less. So just as an example to put that percentage into perspective, if I'm testing someone in the booth and they got 10% of word understanding in the right ear, that just tells me they're not going to perform well with a hearing aid. Because with a hearing aid, no matter how much I turn up that volume, it's still going to be distorted to that person. Words are going to be distorted. There's not going to be good clarity, and a hearing aid just isn't really the best option for them. With someone who has 10% of word understanding, we would want to switch gears and look into a cochlear implant for them, because again, we're bypassing that 10%, we're bypassing the inner ear and really just providing direct stimulation. So that would be probably a better option for that individual, because they're not going to get the clarity they need with a hearing aid. Another main difference again with a hearing aid and a cochlear implant is that the process for getting a cochlear implant is more extensive. So it requires more visits. Just as an example, you would have to get a cochlear implant evaluation, which is performed by the audiologist. And then if you are a candidate, the next step would be to meet with the ENT or otolaryngologist. And you would have to get a CT scan to make sure anatomically you would be a good candidate for the surgery. And then, of course, you get your surgery, and then you have to wait a month for the incision site to heal before the audiologist can activate the implant for you. And after the activation, it does require a lot of follow-ups with your audiologist. So unlike a hearing aid where it only takes, a few weeks for your brain to adapt, a cochlear implant takes a little bit longer. So you may not reach your full potential with an implant until the 1-year mark. So you will be seeing your audiologist quite frequently for the first year post-surgery, because there's a lot of programming adjustments that need to be done and a lot of fine-tuning. So it does require more visits and a little bit more work on your end. So your audiologist would give you materials to take home. You would have homework essentially. You would be practicing oral rehabilitation and things like that to really get your brain adapted to the implant, because the sound is much different than a hearing aid. Another question that I get from patients is, will my insurance cover it? So fortunately with implants, most insurances do cover implants, which is fantastic. So unlike a hearing aid where insurances, most of them do not cover it, implants on the other hand, most insurance companies do, which can be a relief for a lot of people. But yeah, that's really, the main difference between an implant and a hearing aid. So if you guys have any questions for me, you can feel free to comment below, and make sure to like and subscribe our page. If you like learning all things about audiology and hearing aids and implants. But I hope all of you have a great rest of your day. Bye.